You know that feeling when your young dog who you thought was, well, finally getting the hang of things suddenly starts having accidents inside? It's instantly concerning.
Oh, absolutely. It's a worry every pet owner knows.
Yeah.
And when it's a younger animal, your mind just races trying to figure out what's wrong.
Exactly. And today we're going to dig into one specific reason this might happen. It's a condition called ectopic ureter, or EU for short.
That's right. We're taking a deep dive into EU, drawing from some really informative veterinary sources.
Ectopic ureter. Sounds, well, a bit technical. Can you break it down simply? What is it?
Sure. Think of the urinary system. Like plumbing, you've got kidneys making urine, and then these tubes, the ureters, carry it down to the bladder.
Okay, like pipes.
Exactly. Normally, those pipes connect right into the bladder, the storage tank.
Yeah.
But with ectopic ureter, it's like they were plumbed incorrectly during development.
Ah, so a construction error from the start.
Pretty much. Instead of emptying neatly into the bladder, the opening ends up somewhere else, somewhere further down. It's congenital, meaning the pup's born with it,
So the urine doesn't always make it to the bladder, it just sort of bypasses it.
or leaks out after the bladder. The opening can be, well, in a few wrong places. It could be just past the normal spot in the bladder trigon, or it could be in the urethra, that's the tube leading out, or even the vagina, the vestibule, sometimes the uterus or prostate.
Wow, okay. So quite a few potential spots for things to go wrong.
Hmm.
And the big sign for an owner, the thing that makes them call the vet, is usually...
Urinary incontinence, constant or intermittent leaking, because that urine isn't being held properly.
Makes sense.
And it's actually a very common cause of incontinence, especially in young female dogs. We see it in adults too, sometimes, and less often in cats or male dogs.
You emphasized female dogs there.
Yeah, the difference is pretty striking. The sources mention a ratio of about 20 female dogs affected for every one male dog.
20 to 1. That's
Yes.
huge. So, okay, we know what it is the plumbing's off. But why? What actually goes wrong during development to cause this?
It boils down to how the whole system forms in the embryo. There are these early structures, the mesonephric and medanephric ducts, kind of like the initial blueprints.
Right.
With EU, something goes awry in how those blueprints are, well, read or followed.
Mm-hmm.
The ureters just don't end up terminating in the correct spot in the bladder, a developmental misstep.
A glitch in the system, basically.
Exactly. And there's a specific quirk mentioned in dogs.
Oh, yeah.
In like over 95% of canine cases, the ectopic ureter runs intramurally,
Intramurally, meaning...
meaning it tunnels within the wall of the urethra, kind of in the layer just beneath the surface lining for a bit before it opens in the wrong place, like a hidden detour inside the final pipe.
Huh, interesting. And you mentioned male dogs have it rougher sometimes. Something about blockage.
That's right. While it's less common in males, when they do have EU, it's often linked with more severe issues like hydronephrosis, that's the kidney swelling up with backed up urine, and hydroreter, which is the ureter tube swelling.
Why is that more common in males?
It seems the misplaced opening in males often tends to be narrowed, what we call stenosis. So it physically restricts the urine flow more, causing that backup.
Got it. It sounds like EU is rarely a solo problem, though. The sources mentioned a whole list of other potential issues happening at the same time.
That's a really key point. Because it stems from that early developmental phase, you often find other urinary tract abnormalities alongside it. It's like, if the foundation's a bit off, you might find other cracks in the walls.
Makes sense. So what are these common companions to EU?
Well, very frequently we see something called urinary sphincter mechanism incompetence, or USMI. That's basically a weak bladder outlet valve. Over 75% of EU cases have this too.
75%, wow.
Yeah. And then there's patent urachus, that's a leftover tube from birth, connecting the bladder to the belly button that didn't close properly. That's seen in over 90% of cases.
90. Okay, so these things really do travel together.
They really do. Chronic UTIs, urinary tract infections, are also super common, around 80% prevalence. And then, as we discussed, hydroreter and hydronephrosis, the swollen ureter and kidney, are found in maybe 35 to 50% and 25 to 50% respectively.
And the others?
Yeah, sometimes you see dogs with unusually short urethras, or their bladder sits too far back in the pelvis. That occurs in about 20% of cases. It really shows how complex that whole developmental process is.
Definitely paints a more complicated picture than just a leaky pipe. So, recapping, who gets this? Mainly young female dogs. But are there particular breeds we should know about?
Yeah, it seems some breeds might have a predisposition, suggesting genetics could play a role. Retrievers, like Labs and Goldens, are mentioned often. Also Siberian Huskies, Newfoundlands, Poodles, and various terriers.
Good to know. So if you have one of those breeds and see leaking,
It's definitely something to bring up with your vet, yes.
okay, so let's talk signs again. For you, the owner at home, what are the classic things to look out for?
The biggest one is that constant or maybe intermittent dribbling of urine, often starting right from puppyhood. You might notice the bedding is always damp or the puppy leaves wet spots wherever they lie down, even right after going outside.
Is it always leaking, or can they still pee normally sometimes?
It's a good question. Some can still posture and void a normal amount of urine in addition to the leaking. That can sometimes confuse things a bit.
I bet. Makes you think maybe it's just house training issues.
Exactly. Also, those recurrent UTIs we mentioned can be a sign. And importantly, remember, the male dogs, they might not leak at all, but could still have serious kidney and ureter swelling discovered incidentally.
Right, the silent cases. Crucial point. So let's say the vet suspects EU. How do they actually confirm it? What else might they be thinking it could be?
Diagnosis involves ruling out other possibilities. First, what we call differentials. Could it be just USMI, that weak sphincter on its own? Or maybe behavioral inappropriate urination, a simple UTI.
Okay.
In females, sometimes urine pools in the vagina and leaks out later that can look like incontinence. And as we said, male dogs might have congenital kidney ureter swelling without EU. Or it could be related to anatomy, like that short urethra or intrapelvic bladder.
So quite a few potential culprits. What are the first steps, test-wise?
Usually it starts with the basics. Blood work, like a CBC and biochemistry panel, and a thorough urinalysis. These might be normal, but they help check kidney function and look for signs of infection or other systemic issues.
And checking for infections specifically.
Absolutely. A urine culture and sensitivity is key.
Yeah.
Ideally, the sample is collected via cystocentesis using a sterile needle to get urine directly from the bladder to avoid contamination.
Right. Then comes the imaging, I assume. That seems critical here.
Yes, imaging is where we really try to visualize the problem. Several options exist.
What's considered the best?
Cystoscopy is often preferred. That's using a tiny camera, a scope, inserted into the urethra and bladder. It lets the vet directly see where the ureters are opening. It's got really high sensitivity, like 96%.
Wow. Okay, so you can literally see the misplaced opening.
Exactly. Another excellent tool is a helical CT scan. It gives detailed 3D anatomical images and is also very accurate, around 91% sensitivity, better than standard X-rays.
What about ultrasound? Lots of people are familiar with that.
Ultrasound is definitely useful too. It's non-invasive and can show the kidneys, ureters, bladder structure. Sensitivity varies a bit more, maybe 60–91%, but it provides good anatomical info, especially looking for that hydro or hydronephrosis.
The sources also mention some other X-ray techniques using contrast dye.
Right, like excretory urography, or EU. Confusing acronym, I know.
Ah, yeah.
Also called an IVP. You inject dye into the vein, it gets filtered by the kidneys, and you take X-rays as it moves through the urinary tract. Sensitivity is maybe 50–75%, often done with contrast, but directly into the bladder or air, and maybe into the vagina or urethra too.
What are those good for?
They can help see the dilated ureters or kidneys or other associated problems. Less sensitive for spotting the EU opening itself compared to cystoscopy or CT, though. There's also retrograde urethrophy, injecting dye backwards up the urethra, but its sensitivity for EU is even lower, under 50%.
So cystoscopy or CT seem like the top choices for pinpointing the EU.
Generally, yes. And the sources mention cystourethrovaginoscopy as the definitive procedure.
That's a mouthful.
It is. It's basically an extended cystoscopy that carefully examines the urethra and, in females, the vagina too. It gives the most detailed view to confirm EU, find the exact opening, check for short urethra, multiple openings, things like that.
Okay. And one more diagnostic tool, urethral pressure profilometry, UPP. You mentioned it regarding the weak sphincter, USMI.
Right. UPP measures the pressure along the urethra to see how well the sphincter is working. It's good for diagnosing that concurrent USMI, which is super common.
But does it help with the EU itself?
Not directly for diagnosing the EU or deciding how to fix the misplaced ureter. And sometimes if there's an intramural EU, it can actually interfere with the UPP readings a bit. So useful for the sphincter aspect, less so for the EU itself.
Okay, makes sense. So we finally have our diagnosis, ectopic ureter. What happens next? What are the treatment options?
There's a range, thankfully. It depends on the type of EU in the individual case. One option is minimally invasive, cystoscopic guided laser ablation, or CLA.
Laser ablation, how does that work?
It's specifically for those intramural cases where the ureter tunnels in the urethral wall. Using the cystoscope for guidance, a laser fiber is used to create a new opening from that tunnel directly into the bladder in the correct spot.
Ah, neat. What are the advantages?
Big ones are that it's minimally invasive, much less recovery time than traditional surgery, and you can often diagnose and treat in the same procedure. Plus, they can often address associated vaginal defects at the same time, which apparently are present in almost all females with intramural EU.
95%, the sources said. Wow. But what if it's not intramural or laser isn't an option? Then it's surgery.
Then you're looking at more traditional surgical options, yes, especially for extramural EUs, where the ureter completely bypasses the bladder wall.
What kinds of surgery?
The main one is called Neoureterostomy. That's where the surgeon essentially detaches the misplaced ureter and re-implants it into the bladder in the correct location. Sometimes involves reconstructing the end of the ureter or urethra too.
Okay, re-plumbing it properly.
Exactly. Another option, rarely needed, is ureteronephrectomy. That's removing the affected ureter and its kidney. And this is a huge BUT that should only ever be considered if that kidney has absolutely zero function left and the other kidney is perfectly healthy. You never want to remove a functional kidney.
Understood. That sounds serious. Surgery in general sounds like a bigger deal than the laser. Are there risks?
Yes, definitely. Surgery comes with a higher complication rate, maybe 14–25%. Things like strictures, where the ureter scars and narrows, urine leakage from the surgery site, or infection.
And does surgery guarantee the leaking stops?
That's the other crucial thing owners need to understand. Unfortunately, no. Even with successful surgery to correct the ureter's position, persistent incontinence is common. Estimates range from 45% to even 70% of dogs still having some leakage afterwards.
Oh, wow. So fixing the plumbing doesn't always fix the leak entirely?
Often not entirely on its own, no, because often that underlying USMI, the weak sphincter, is still there. But the good news is, additional treatments can usually help manage that remaining incontinence.
Okay, that brings us to medications. What can help if the dog is still leaking after laser or surgery?
Several drugs can help tighten up that urethral sphincter. Phenylpropanolamine, or PPA, is very common. It's an alpha agonist. On its own, maybe it helps 10–20% more dogs become continent, but combined with the correction, it often pushes the success rate up to, say, 50–60% continence. Okay, that's a significant improvement. Any others? There's decuylstilbestrol, DES, which is an estrogen hormone. It can also help strengthen the sphincter. However, big caution here, DES has potential for serious side effects like bone marrow toxicity. So it needs very careful consideration and monitoring.
Right, important warning. Are there safer hormone options?
Yes, estriol is another estrogen available in tablets. It's generally considered safer, and the dose can be carefully adjusted. Sometimes combining estrogen and PPA works better than either one alone.
And for the male dogs?
For males, testosterone injections might be tried. There are shorter and longer-acting forms, again, used to help sphincter tone, but generally not recommended for dogs that aren't fully mature yet. Estriol can also be used specifically for what's called estrogen-responsive incontinence, following a particular dosing schedule.
So quite a few medical tools to help manage that persistent leakiness.
Definitely.
Are there any other treatments beyond meds that can be tried after the initial correction?
Yes, a couple more invasive options exist. One is injecting bulking agents, special substances, into the urethral wall via cystoscopy. The idea is to physically narrow the passage and help the sphincter close better. This might get continence rates up to around 60–65%.
Okay, another step up.
And then for really tough cases, there's the option of surgically placing an artificial urethral sphincter. This is usually a hydraulic cuff around the urethra that can be inflated or deflated via a port under the skin to control urine flow.
Whoa, like a little internal valve.
Kinda, yeah. It's more complex surgery, but it can be very effective, potentially getting continence rates up to 80 or even 90%.
That's impressive. So it sounds like achieving dryness can be a journey, maybe involving multiple steps. What's the overall outlook?
It's important to be realistic. After just the initial surgery, maybe only 25–50% are fully continent. After laser, maybe 40–55%.
Right.
But with those additional therapies, meds, bulking agents, maybe the artificial sphincter, you can often get much better results, closer to that 60%, 65%, or even higher in some cases.
And follow-up is important.
Absolutely crucial, especially after surgery. Monitoring for those potential ureteral strictures is vital, because a blocked ureter can quickly damage the kidney permanently. So regular vet checks, maybe follow-up ultrasounds are definitely part of the plan.
Okay, so let's wrap this up. Ectopic ureter. It's a birth defect. Ureters are plumbed wrong, leads to incontinence, mostly in young female dogs. Diagnosis needs good imaging, like cystoscopy. Treatment involves fixing the plumbing, often with laser or surgery.
but frequently needs ongoing help with meds or other procedures to manage lingering incontinence due to sphincter issues.
Right. And while perfect continence isn't guaranteed from the first step, there are lots of tools now that offer real hope for a much better quality of life for these pups.
Exactly. Early diagnosis, a tailored plan, and owner commitment are key.
This has been super helpful, really shedding light on a tricky condition. It really makes you think, though. Considering EU often comes with all those other urinary issues, what other related congenital problems might be out there in the urinary tract? It just underscores how complex development really is.